project that we have in collaboration started actually 7 years ago. It started off with a common interest in trying to improve treatment of endocrine therapy in estrogen receptor positive breast cancer patients. And I had this interest, a long-term interest in this drug Fulvestrant, because it has very unique characteristic that some of which is known is promote the degradation of the estrogen receptor, but one of the activity that was never really recognized is that when the newly synthesized estrogen receptor is being produced in the cytoplasm, when it binds to fulvestrant, it causes the aggregation of the estrogen receptor. So that was known before, but it was never actually appreciated that it may actually be useful to increase the efficacy of fulvestrant. Protein aggregates are known to be cytotoxic in neurodegenerative disease. And so we had a unique opportunity here to have the aggregation or the induced aggregation of the estrogen receptor that could lead to more toxicity. Some of the way by which cells get rid of protein aggregate in general is the proteasome. And there's a proteasome inhibitor that has been quite successful in multiple myeloma called bortezomib. We decided to combine fulvestrant with bortezomib. That led to the massive accumulation of the cytoplasmic aggregates of the estrogen receptor. And in mouse model, in vitro and in vivo model in the lab, we were able to show that adding bortezomib increased the efficacy of the drug. So this is essentially the scientific rationale that led to the trial that will be presented by Dr. Adelson.
Based on the work that Dr. Germain did in her laboratory, postulating that the combination of fulvestrant and bortezomib might enhance the cytotoxic activity of fulvestrant, we embarked on a randomized phase 2 clinical trial comparing fulvestrant alone to fulvestrant plus bortezomib in women with metastatic breast cancer that had progressed on a prior aromatase inhibitor. Women who were randomized to the standard of care fulvestrant arm were allowed to cross over to the combination of fulvestrant plus bortezomib after progression as a proof of principle that the combination may also work in women treated with prior fulvestrant.